Hello, I am Sarah, Dr. Jimerson's Marketing Director and the host of this webinar. I would like to thank everyone for joining us to learn about Dr. Jimerson and his famous procedure, the buttock augmentation with fat grafting, also known as the Brazilian butt lift or Dr. J Curves transformation. I see we have a lot of people from all over, so I know that this is a hot topic, and I hope that the information you receive during this webinar will help you in making a decision as to whether a butt enhancement procedure might be right for you. This webinar is going to be extremely thorough. We're going to be discussing every detail about the surgery. In a moment, I'll be introducing Dr. Jimerson himself. Just some housekeeping things. Make sure that your speaker volume is turned all the way up. After the webinar, you can review it again in case you missed something. If you decide to book a consultation, you will be assigned a patient coordinator who will answer all of your questions and help you throughout your entire journey. You will also have access to speak to Dr. Jimerson at that time. Just some warnings, some of the slides are graphic. You will see the female anatomy from the neck to the knee, but these images are meant to be educational and they show some before and after images, so hopefully they will be helpful in determining if this procedure is good for you. During this webinar, we're going to be going over the following topics to inform you to the fullest on this surgery. You'll be hearing from Dr. Jimerson himself on his technique for accomplishing this incredibly successful surgery that so many women from all over the world are dying to achieve. We will be covering everything you need to know, such as price, how to prepare, aftercare, and if you would be a good candidate for the procedure. Once you know everything that there is to know about Dr. J and the surgery, if you decide that you would like to move forward, you will be able to book your surgery. Stay tuned to the very end to learn how you can schedule your surgery and your payment options. So with that said, let's get started. At this time, I would like to introduce Dr. Jimerson. He is originally from Cleveland, Ohio. He attended Case Western Reserve School of Medicine and then did his plastic surgery training at Ohio State University. He is board certified by the American Board of Plastic Surgery and currently in private practice in Atlanta, Georgia. Nearly 100% of his practice consists of cosmetic surgery of the butt, breast, body, or face. He has a special interest and passion in butt enhancement. He is originally from Cleveland, Ohio. He attended Case Western Reserve School of Medicine and then did his plastic surgery training at Ohio State University. He is board certified by the American Board of Plastic Surgery and currently in private practice in Atlanta, Georgia. Nearly 100% of his practice consists of cosmetic surgery of the butt, breast, body, or face. He has a special interest and passion in butt enhancement procedures and has done thousands of Brazilian butt lifts. He operates on people from all over the world and all walks of life. He is considered one of the most popular plastic surgeons in the world, and his work has been featured on multiple TV shows, news programming, and radio shows. His expert opinion has been published in major magazines and publications. He has an excellent track record for making his patients happy, and his patient satisfaction scores are very high. So, without further ado, Dr. Jimerson, take it away.
Thank you. Now, for the Brazilian butt lift. So, as many of you may know, it's one of the fastest growing areas of plastic surgery, and that is also one of my passions, which is why I love it. But it is gaining popularity all around the world. I do people not only from America, but Latin America, Tokyo, Germany, Dubai, just all over Africa. So this is gaining popularity all around the world. And I don't know, why it's gaining such popularity. Maybe it's from Sir Mix-a-Lot's Baby Got Back song or Cisco's Thong song, or maybe it's from the array of female actresses and socialites that we see portrayed across the media. But whatever the reason is that this procedure is gaining popularity, there's one common question: how do I get it, and what are my options? So let's go through some of the options that you have. There are non-surgical options. So, some of these options are either butt pads, that you buy at the local garment store, or you can get a garment to kind of hike up the butt. So that's usually a starting point. That's for people who are sort of interested in it and kind of getting the feel. There are other options. There's a black market option. So the image on the left shows someone who's just I was a non-doctor who was injecting hydrogel and silicone. He was he was impersonating a doctor and injecting hydrogel and silicone into patients. Now, this silicone is not medical grade. I mean, it's stuff you can buy from your local hardware store, and the consequences can be devastating. And so the picture at the bottom right shows what can happen, with this type of procedures. This is not a good idea, okay? You can work out. So I think that working out is a good option. The only problem with working out is it only addresses one part of the butt, and that's the muscle, but it doesn't really address the fat. So, I think the butt is made of not only just muscle, but fat. So I think that working out is helpful in building up, a nice solid base. But I also think that if you want a complete option, then you should combine working out with surgical options. And your surgical options, you have butt implants, and you can have the Brazilian butt lift. The butt implant involves taking a solid silicone implant and then placing it either above or in between the muscles, and then the Brazilian butt lift. And the Brazilian butt lift is basically a popular or famous term that is used to describe a procedure where fat is taken from different areas of your body, okay, and that fat is used to shape and augment your butt. And the reason that people are getting it done, these are just some examples of my patients, is because it allows you to fit better in your clothes. It allows you to look better out of your clothes. You feel more confident. You just feel sexier. So that's why people are getting it done. And is it worth it? Well, 93% of people on Real Self think that is worth it. And because if you look at the patient, this is the before and after one of my patients, and you can see where she started and where she ended up, and she feels a lot sexier. She wears different types of clothes now, so she thinks it's worth it. So let's talk a little bit about the procedure. Okay, so the Brazilian butt lift is really performed in two different stages. Okay, so the first stage is fat harvesting. So that's again, where you take fat from different areas of the body, you process the fat, get pure fat, and then the second part of the procedure is butt shaping and fat grafting. And so the butt shaping involves not only just fat grafting, but also liposculpture. So, and then we can do the Brazilian butt lift in combination with other procedures like butt implants, the butt lift procedure, or inner thigh lift. So where do I get the fat from? That's where people, always want to start. Well, I always decide on where I get the fat from what area of the body that I want to accentuate. So I want to accentuate the butt. So I think the most important place to get the fat from is your lower back, because that also helps to shape the top part of your butt. And I also want to make the waist smaller. So I also want to get fat from your flanker love handle area, and then your belly. And I make the decision about where I'm going to get the fat from for the procedure based on how much fat you have in those different areas. But in general, I like to do the lower back, the flanks, and the abdomen. And then the butt shaping, that's the secret sauce. That's the secret sauce of the procedure. That's what separates different surgeons from each other, and that's pretty much what you're paying for. So, for me, I do a combination, like I said, of liposculpture and fat grafting. And in order to understand how I'm going to shape the butt, I have to listen to the patient. So I want to first understand what your desires are as a patient, what you see as an ideal butt. And then I need to look at your genetics and decide how I can change some of the things that are already present to reshape your butt. Okay. So common patient desires. If you look at the lady on the bottom right, you can see that she has more fullness at the bottom of her butt. So some people want more of a heart shape fullness at the bottom of the butt. So that's one desire. Some people, like if you look at the top left, you'll see some people want more of a shelf look. And then if you look at the two images on the bottom left, some people just want a little bit of fullness. They don't want a huge butt, but they do want a definite change. And then some people want a bigger butt. So it really, the size depends on, patient, ethnicity, culture, and then also how they, where they want the fat placed. All right. And then there are genetic issues that, we have, as surgeons, have to contend with too, to try to reshape the butt. And I can use liposculpture to sort of alter, the lack of volume or a lack of shape, converting someone from sort of a V shape to an A-frame shape, or someone who has lack of definition, and trying to actually create the top part of the butt or the sides. And sometimes we'll do fat grafting to the hips if they need fat grafting to the hips. So those are some genetic things that we have to alter as well. So who are good candidates for this procedure? Well, basically anyone who thinks that their butt is too small, too flat, or out of proportion with the rest of their body. And also people who are in good medical health, because this is a major procedure. So, that would be determined by your surgeon and your primary care doctor before your surgery. Now, I find that the people who have the best results are people who are no more than 15 to 20 pounds heavier than their goal weight. And I use a goal weight instead of ideal body weight because, everyone is not going to go down to their ideal body weight. So when I mean goal weight, I mean what weight do you think you look the best at? And, so if you're about 15 pounds heavier than that, that's a good place to start, and I think you have a great result. Also, people who obviously who already have an ideal body frame and a good initial shape will have good results. People who have loose butt tissue. So I always ask, is your buttock tissue tight or is it loose? The looser it is, the easier it is to shape. The tighter it is, the harder it is to put fat in there, is the less fat it'll take, and the harder it is to shape. Also, is your butt symmetric? Now, a lot of people don't realize this, but they realize that their breast might be asymmetric. They don't realize that their butt might be asymmetric too, or they might have scoliosis. So, but the more symmetric you start with, obviously the better your results are going to be. And then obviously if you don't have dimples or cellulite, then your results are going to be better. But the person who has the best result is someone who has a realistic expectation, okay? So I spent a lot of my consultation trying to understand what my patient's expectations are, and then making sure that they're realistic and setting realistic goals. So, I always tell people, you can't go from the image on the left to the image on the right in one surgery. It's just not going to happen. So you really have to be realistic. So the next thing that people want to know is, what if I don't have enough fat? What do I do? Well, the first option is to gain weight. So, I really like doing fat grafting over butt implants for the complication rate. So I always want to give people the option to gain weight. And, a lot of people have trouble gaining weight. And it always sounds kind of weird for doctors to say, okay, gain weight. But this is the one time where, gaining weight is good, and people are worried about gaining weight, and they're worried that, what happens if they don't, lose it. Well, what happens when you gain the weight is we're going to take all of that fat and we're going to put it in your butt. So you're still going to have a nice shape, nice flat belly, and, your sides are going to be nice and hourglass shape. And we can use that fat to place in your butt. So we really like people to gain weight using either Ensure or some type of protein shake that is high in calorie. And it usually takes, a couple months, maybe 1 or 2 months to gain the weight. Now, if after that time you didn't gain enough weight, the next option is to do butt implants with fat grafting. So, we would put a smaller implant in, and I use an intramuscular approach to put the butt implant in. We basically make an incision in the intragluteal crease. And so there's 2 incisions. I dissect down into the muscle, and I place the solid silicone implant in between the muscles. I cover the implants with muscle, and then I close everything up. So you end up with 2 incisions in the intragluteal crease, which is essentially your crack, okay? And so that's the butt implant. And then I would liposuction either the lower back, the flanks, which is love handles, or the abdomen, and then I would use the fat over the implant to soften things and to create fullness and shape Okay, so I use the implant for projection, and then use the fat for more shaping and fullness. Now, if it's just impossible, you can't gain any fat, then we're just talking about doing implants only. Now, a lot of times when I'm doing the Brazilian butt lift, people want other things done. They want more areas of liposuction. So common areas of additional liposuction that people will want is their back bra rolls, which is the rolls in the center of your back, or there's rolls in the upper back. They want their inner thighs liposuction, their arms, or their outer thighs. So these are common areas that we can liposuction while we're doing the Brazilian butt lift. Some people want tummy tucks, or will either need or want tummy tucks, and we can do that during the procedure, or we can do it in a two-stage procedure. So we do the Brazilian butt lift and then come back and do the tummy tuck. And that really, the determination as to whether I would do a tummy tuck at the same time as the Brazilian butt lift would really determine on where you were in relation to your goal weight. So the heavier you are, the more likely I would want to do it at 2 stages. But if you were closer to that and just had some extra skin, then we could do it at 1 stage. And then some people want their breast lifted or augmented, either with an implant, or we can do fat grafting in the breast, and we can do that at the same time, or a medial thigh lift. So those are some other combination procedures that we can do. So that's pretty much the procedure. I wanted to get into some before and after slides just to kind of show you some results that on some of my patients, so that you can kind of understand what we're doing. So the first case is an African-American female. She's in her mid-30s, and what I did on her was I did fat harvesting from her abdomen, her flanks, and her lower back. And I also did, I needed to go to her inner thighs to get a little more fat. And then I injected, so I had a total aspirate, or I sucked out a total of 3,500 cc's of fat. And then I injected 885 cc's of fat into each buttock. And I also did buttock shaping, and she's very happy with her result. This is just another image of her, and you can see the change in her love handle area, and because she had a nice frame, we were able to give her a nice heart-shaped buttock. All right, this is the second case. This is a Middle Eastern female. She's 34 years old, mother of 2. She was pretty athletic and happy with life and happy with her body, but she wanted more fullness in her buttock, and she wanted a better shape. She also wanted a flatter tummy and more of an hourglass figure. So what I did on her was I did fat harvesting from her abdomen, her love handle flank area, and the lower back. And also her back bra rolls. She really didn't have much back bra rolls, but she wanted those liposuction as well. I did her inner thighs and her arms, and I put 750 cc's of fat into each buttock, and as you can see, she has much more better contour of her waistline and more fullness in her buttock area. And you can also see how the lower back, from the before and the after, how the lower back has more definition at the top part of the butt and more fullness. Okay. And this is just another slide showing her from the side profile. You can see her tummy is flatter, and she has much more projection and roundness in her buttock. All right, case number 3. This is a 21-year-old African-American female, and she wanted more of an hourglass shape, and basically just a bigger butt. So what I did for her is I did fat harvesting from her abdomen, her flanks, her lower back, her inner thighs. And then I took a total of 3,400 cc's of fat out, and I put 750 cc's of fat in her buttock, and I also put some fat in her hip area, so you can see her hips are rounder as well. So she has definitely more of an hourglass shape, or more curves, and that's what she wanted. All right, and this is just another image of her. All right, so case number 4. This lady, again, African-American female, and she actually didn't want that big of a butt. I mean, she wanted more definition and more curves, but she didn't want a huge butt. So with her, I took fat from her abdomen, her flanks, and her lower back, and I put 700 cc's into her butt. Now, you know, you can tell from the case before, in this case, you know, that case before I put 750 cc's, and in this case I put 700 cc's, and you can tell her butt is definitely smaller than the other one. So it doesn't always matter about how much fat I put in. It's all about shaping and where I'm taking the fat from and where I'm placing the fat. So, you know, when people are coming to ask me, you know, they want a certain amount of cc's, it is really not about, is a very dynamic process. So, you know, really I just need to understand what type of butt you want and what shape, and then from there I can kind of determine intraoperatively how much fat I need to place. This is just another image showing her. You can definitely see her waist is improved and she has more fullness. She's happy. All right. Okay, case number 5. This patient, she could not gain any weight at all. So in her, I had to place just butt implants only. So that's what we did. So, you know, I couldn't do any liposuction of her waist or anything. And she really actually didn't need any liposuction, but you can see that she definitely has more fullness. Her butt is definitely more projected, than the before picture. So this is an example of just butt implants without fat grafting. And this is just her again, and you can see that she has definitely more fullness of the butt, and it actually makes her waist look a little bit thinner. All right, case number 6. This patient was someone who could gain a little bit of weight, but just did not have enough fat for me to do the Brazilian butt lift only. So I did a Brazilian butt lift in combination with butt implants. And this is an Asian female. She's in her 20s. So, you know, what I did is I liposuctioned, from her abdomen. I got some fat from her love handles and her lower back, so I tried to give her some more curve in those areas. I placed the butt implants in, and then I placed fat around the implant to give it more fullness and volume. So that's her before and after. And this is another image showing her from the front to back view. And you can definitely see that she has more fullness in this area. Okay. And this is just her again. You can see the side profile, and you can see how her tummy's definitely improved, her lower back, and she has more projection. And this is the final case I'm going to show you. This patient is also someone who could gain a little bit of weight, but didn't have enough weight to make for me to be able to just do a Brazilian butt lift only. So in her, I liposuction, or I got fat from her lower back and her flank area. I put a small implant in her buttocks to give her the projection, and then I used fat to again create shape and contour in her buttock. And so this is her before and after. She's a mom. They're in her 30s. She's a Caucasian female, and she's very happy. She has more shape, and she can wear the clothes that she wants to wear. So I hope that this was helpful in helping you to determine if the Brazilian butt lift or any butt enhancement procedures is right for you. When you're researching for your doctors, join their Facebook pages, because then you can talk to their patients, talk to their staff, try to do some research. Make sure that whoever you pick is an expert in this procedure, because This is a procedure kind of like rhinoplasty. It's very, not a lot of people understand the whole dynamics of it. And this is one of these kind of one-shot procedures because once all your fat is used, it's hard to go back and redo it. So you definitely want to pick someone who does a lot of these, who does several of these procedures a week. So that's the presentation.
Thank you so much for all that information, Dr. J. Isn't he great, ladies? Now that you know everything about the butt augmentation with fat grafting and what you will need to prepare for the surgery, on to the fun part. We are going to discuss pricing and how you can get on Dr. Jimerson's surgery schedule. At this point, only those of you who are serious about booking need to stay present for the remainder of the webinar. To those of you who are not ready to book, I hope you found the presentation informative and I look forward to hearing from you in the future. Thank you. Now that I'm speaking to only those of you who are ready to book, please pay close attention. In order to move forward with your surgery, you will need either a personal assessment or an in-house consultation. For a personal assessment over the phone with a patient coordinator, there is a charge of $50. If you prefer to come in for a consultation, the charge is $100. Please note that these fees are applied towards your surgery costs. To purchase your personal assessment or in-house consultation, please click the Buy Now button at the bottom of the screen. This is your first step to get on Dr. J's surgery schedule. Once the purchase has been made, you will receive a series of emails. The first email will be a receipt of payment. Second, if a personal assessment was purchased, an email with instructions on how to send your photos. You will not receive this email if an in-house consultation was booked. Lastly, all patients will receive an email with a link to load all your personal and medical information. These steps must be completed before your patient coordinator can contact you. You can click the Buy Now button at any point to purchase your consult. As most of you know, Dr. Jimerson books up very far in advance. One good part about that, though, is that you can book your surgery now and make payments on it until it's paid off. If you are prepared to pay for the entire amount without financing and are hoping to have your surgery as soon as possible, we have options for you too. If you select to book your surgery now, for $500 you can lock in your price and reserve your date for the next spot in his surgery schedule. You will have 3 weeks before your surgery date to pay off the procedure or apply for your financing. If you want to have your surgery sooner, we offer the Fast Track List. The Fast Track List is a list of patients who are waiting for a cancellation in Dr. J's surgery schedule. In order to be on the Fast Track List, you A, must not be using any financing, and B, have a zero balance. The list is short and moves quickly. Surgeries are booked so far in advance that frequently patients need to reschedule their appointments due to life changes like a change in job or pregnancy. If you are on the fast track list, you will be moving up in the schedule, but it is not guaranteed if you will have the exact date that you would like. Either way, patients on the fast track list receive a $500 discount for not using financing and will be having their surgery much sooner. As most of you already know, this surgery consists of liposuction to 3 areas: your abdomen to bring in your waistline, your lower back to give you the top arch of your behind, and your flanks or love handles to give you that nice Coke bottle curve in your waist. That fat is then grafted to your butt, under, over, and inside the muscle. We say that $10,300 is the starting price for this surgery since additional procedures are commonly added on. If you do not need any additional procedures, then this is the price. Some patients start out thinking that with only one surgery certain results will be accomplished, when it might be necessary to add on additional procedures such as lipo to other areas, a tummy tuck, or most commonly added, hips. These are the most commonly added on procedures when patients are having the buttock augmentation with fat grafting: tummy tuck, additional liposuction, and hips. The price for more lipo other than your abdomen, flanks, or lower back is $950 for each additional area of liposuction. The most commonly added on area of liposuction is the back bra roll, showed here in this photo. A few other areas that are frequently added on are arms, inner thigh, upper back, front bra roll, or outer thigh. By law, Dr. Jimerson can only lipo 5,000 cc's. Depending on the patient's size, it might not be possible to do too many additional areas of lipo at the same time. Because most of us wait until after children to have plastic surgery, the majority of patients have been through pregnancy and have loose skin around their stomachs. Even if you have not had children but went through drastic weight loss, you might still have the loose skin. During your butt augmentation, when Dr. J liposuctions all the fat out of the 3 areas in your midsection, if you already have loose skin, the skin will only become looser and only a tummy tuck would be able to correct this. This patient in these photos had twins. These pictures are 3 months after surgery. As you can see in the bottom left photo, there will be a scar from hip to hip where the skin was removed and then sewn back together. During a tummy tuck, Dr. J will remove all excess skin from the abdomen and tighten your abdominal wall muscles the way they were before children. To add a tummy tuck to the procedure, it is $5,500, bringing the total to $15,800 for the buttock augmentation with fat grafting and a full tummy tuck. This patient had 300 cc's of fat grafted to her hips. To add hips onto the surgery, it is $1,150, bringing the total to $11,450 for both hip and butt augmentation with fat grafting. The hips are the icing on the cake. If you need a tummy tuck with the surgery, adding hips will only be $1,000 more. You can see where the arrow is how Dr. Jimerson was able to round out this patient's hips where they used to go in, instead giving her a perfect Coke bottle curve to go with her new full butt. Patients come from all over the world every day to see Dr. J. We have several hotels in the area and a list can be provided upon request. You will need to plan on staying in the area for about 2 weeks, 10 to 14 days if you only have the butt augmentation, and 2 full weeks if a tummy tuck is done. Dr. Jimerson is going to be seeing you after your surgery for your post-op appointment, and you will have a drain that needs to be removed. You will be leaving here in a compression garment exactly as shown that will start to loosen up after your swelling starts to go down. Patients need to plan on purchasing a second compression garment that is going to be a size smaller than the first one. You're not going to know what size compression garment to purchase until after your surgery. We will give you the information where you can purchase your second compression garment. Also, patient responsibility is going to be your medical clearance. All patients must be medically cleared a month before their surgery to ensure that they are well enough to have this done. After booking your surgery, your medical clearance will be emailed to you. You would simply need to call your doctor and let him know that you're having elective surgery and need to be medically cleared. If you have insurance, your prescriptions might be covered under your prescription plan, but if not, this is patient responsibility as well. Medications cost around $320 for the average patient. A boppy pillow can be purchased in the baby department of Walmart, Target, or Babies R Us. This is the cushion that you will need to use once you start sitting on your butt again. And again, also patient responsibility is going to be the second compression garment you will need after the first one starts to loosen up. Now that you have your new beautiful booty, you need to know how to take care of it. Patients must plan on no sitting for the first 2 weeks following your surgery. When you come in for your pre-op appointment, we will show you how you can sit and lay down most comfortably these first 2 weeks. The reason for this is because once the fat is grafted to your butt, it needs to establish a blood supply to its new home. So any pressure that you're putting on your butt will be cutting off the blood supply to that area, potentially damaging the chances of the fat living and becoming permanent. It is very important to heed all the advice in order to ensure the best possible results. After the 2 weeks, you can start to resume your normal activity. This is when you will need to be using your boppy pillow for the following 6 weeks whenever you are sitting down. Just be sure that you're not sitting down for extended periods of time, getting up as frequently as possible to walk around. So if you book your surgery today or within the next 30 days, it will be $500 for a date, and you can use financing. I will be sending all patients who ask detailed information on the different financing companies that we work with. Remember that if you apply now for financing, you will have to reapply closer to your surgery date. Also, if any financing is used, you will not be eligible for the $500 discount or for the fast track option. Ladies, the webinar is officially complete. Ladies, the webinar is officially complete. At this point, if you have made your purchase, you can expect to be contacted by one of our patient coordinators or myself within 24 to 48 hours to get you started on your transformation. Thank you so much for your time and attention. I look forward to hearing from you. Thank you again from myself and Dr. J.